by talking about teaching and what are the different methods for teaching and learning, and we will take also a note about how assessment occurs. We have to know that the best method to learn is to learn and teach others. That's why always, if you know something, tell our friends about it. Because when you teach others, this helps you well to memorize up to 90% of the information that you learned. So it's very important to learn and also to teach others. This will help you to memorize more and more of what you learn. The first method, and it's the simplest one, it's lecture. Lecture means that there is a professor and there are audience or students. The professor is explaining certain topic to the audience or to the learners. I think it is the oldest method to learn, to have a lecture about certain topic, or even lecture in a hospital or college or even a school. So we have here professor, and these are the audience. Let's see what the professor says here. He is saying to you, don't give up. You have to do your best. Don't care for the exam result. And this, what I always say to the candidates, that you are studying to achieve better and better knowledge. Of course, you are doing this on the way to success, but you have to work to the day of going to the exam. If during going to the exam, on the way to the exam, on the day of the exam, you feel that you did your best, you feel that you arranged well your time, and you did your best in this, this is a success itself, whatever the result of the exam is. So being self-confident and being proud of yourself during going to the exam, in the same day of the exam, this is a success by itself. And notice that with every day, you will know more and more new information. Information is endless. Even up to the night before the exam, you still learn new information. Science and information is endless. So don't be shy that up to the night before the exam, you still learn new information. This is something good. It's not something bad. So you will learn until the exam day. And the last point, get your hero out. Don't say, I can't. No, you can. You have to arrange your time. I know that we are always busy in our clinics, in our hospitals, but we have to give some sacrifice. You will have some sacrifice from your work, some sacrifice from your home to achieve best in the exam. Okay, sorry again for interruption. I had a phone call. Okay, but anyway, anybody of us has the power to succeed. Okay, and as I told to our friend now, that you have to make a decision that I am going to join this exam and I am going to give my best and I am going, inshallah, to succeed. You know, I succeeded in part 1 and part 2 from the first time. Alhamdulillah. And to do this, I decided that I am going to make it from the first time because I don't have time. I didn't have enough money to join the exam more than once. So I made a decision that I am going to join to the exam once and I will do my best. If I succeed, okay, I succeed. If I didn't succeed, no problem. I had knowledge. It will be easier to me the next time to succeed, inshallah. So the first method is just giving a lecture, professor and students. Some recommendations to make this process of learning and teaching more successful, that you have to know that the audience is interested in this topic. And you have to be sure that they understand what you say. And at last, at the end of the lecture, you have to summarize the important points so you are sure that they already understood what you say. And as we do in our conferences, we have to give what's called take-home message. So this was lecture. The next method is brainstorming. In brainstorming, there is no professor. We, as friends and doctors, we sit together and we start to discuss certain topic. For example, we are all our friends and we want to know what information we know about polycystic ovary syndrome. I will say what I know and you will say what you know, and everybody will tell us what he or she knows about polycystic ovary syndrome. So there is no professor. Everybody of us says what he knows about this topic. This is brainstorming. And it's characteristic that there is no professor. The other method, it's called Delphi technique. This Delphi technique can be done through internet, can be done through mass media, through TV, for example. It occurs by asking certain question or some questions. For example, on the TV, they ask a question and there is a phone number. I will call this phone number, or I will send an email to an email, or I will send a letter including my answer to these questions. And there is a facilitator which collects these answers. At last, the result is summarized and there is a final report. It's called Delphi technique. This Delphi technique is used by internet, through telephone number, through mass media or TV. And it has a characteristic point that there is a coordinator or facilitator. We send letters which are collected to have certain summary at the end to our answers and our information about this point. So it's unique that we use mass media letters or phone numbers, so it doesn't make confusion with other methods. The next method, it's called fishbowl technique. This is the fishbowl, the glass pot which contains fishes. As you see, it's always rounded, it's always circular. That's why it has the same appearance of fishbowl method of teaching. You see, it's circular. You see, it's circular. Here, there are the speakers sitting in a round manner. And here, this is the audience, also sitting in round manners. So it has characteristic point that the speakers are sitting in a circle and also the audience is sitting on a circle. So it has a characteristic point that being in circular manner. So here the speakers, teacher, and students surrounded by audience, circular manner. This is fishbowl technique. The next method, it's called problem-based learning. Problem-based learning, from its name, it's problem-based. So we will say that today we had a case in our hospital of postpartum hemorrhage. So we will start discussing postpartum hemorrhage. We will discuss what we know about postpartum hemorrhage, and we talk about postpartum hemorrhage because we had a clinical problem of postpartum hemorrhage. So it's related to a clinical case that we faced in our practice. The next method, it's called 1 minute perceptor. 1 minute perceptor. As you see, it's called 1 minute. 1 minute. And there is a characteristic point that this method consists of 5 steps. So in the exam, if you are asked about a method which consists of 5 steps, it's 1 minute. If he told you 5, it's 1 minute perception. These are the 5 items of 1 minute perception. They mean that, number 1, the teacher asks the learner to outline diagnosis or management plan of certain topic. And the learner also will justify. For example, the teacher is asking the student, please outline the management of postpartum hemorrhage. The learner will say, number 1, I will do resuscitation measures. I will introduce wide bore cannula. And I will introduce a urinary catheter. And I have to justify. I will introduce the cannula to give up to 3 liters of crystalloids. I will introduce the urinary catheter to collect urine output to see the relation between the input and output fluid, and also to see if there is decreased urine output to diagnose if there is a shock. So I will justify my planning and my outlines for management. After finishing, the teacher will tell me that the general rules for this topic is to do so and so and so. You did what's right and you did what's wrong, so he will give me a feedback and he will correct my mistakes. So it starts by asking a question about management and the diagnosis plan of certain disease. Then the student answers the question, justifying each step. Then the professor tells the student what he did right and what he did wrong, and he will give a feedback about the best management and the best methods for diagnosis. So these are 5 steps. Commitment, he will ask a question, justify each step, and then he will tell the student about what's right, giving feedback and correction of mistakes. Anyway, in the exam, if you are asked about 5 steps, it's 1 minute perceptor method. Another method, directly observed procedure with feedback. How to do this? For example, we have here Dr. Amber. I will ask Dr. Amber, please let me see how you do a cesarean section. I will start to observe Dr. Amber doing the cesarean section. So we are talking about clinical task. After finishing, I will give her feedback. Another example, I will ask Dr. Amber, please let me see how you introduce IV access cannula. And I will give feedback about what was done right and what was done wrong. This is directly observed procedure with feedback. So I will ask the learner to do a clinical task, and I will start to see how this method is done, and at last I will give feedback about what was done right and what was done wrong. Another method, it's called schema activation, and we want to compare it with another method called schema refinement. The difference, activation and refinement. For example, today I want to discuss polycystic ovary syndrome management. At first, I will tell you that the ovary is present in fossa ovarica, supplied by the ovarian artery. The anatomical relations to the ovary are so and so, and the ovary has multiple functions, including ovulation, including hormonal production. So I will start at first to talk about physiology, anatomy of the ovary. Although my topic from the start, polycystic ovary syndrome, but I will start first to talk about physiology and anatomy and the basic science of this topic. If this is the first time that you learn anatomy, physiology of the ovary, this is schema refinement. If you already knew the physiology and anatomy of ovary in undergraduate teaching, so I am doing now schema activation. Activation, I activate your old knowledge about basic science. Refinement, you know already this basic science, and refinement, you don't know the basic science before, and you hear it from me now for the first time. So activation, I am activating your old basic knowledge about this topic. Schema refinement, you don't know before this basic science about the ovary, and you will hear it from me for the first time. Another example here, I'm going to talk about genitourinary prolapse. I will start at first to tell you about what is the pelvic floor, what is levator ani muscle, how it's supplied, what is its function, what are the physiological methods to prevent prolapse. You know this basic science before, so this is schema activation. If you don't know this basic science before, this is schema refinement. So this is the difference between schema activation and refinement. The next method, it's called snowballing. Don't be confused. At last, I will summarize all points and how to identify each method of these. Snowballing, it has a characteristic word that I don't know your current level of knowledge about this topic. For example, today I want to tell you about how to do laparoscopic hysterectomy. But I don't know if you can do laparoscopy or not. So at first, I will start to tell you, do you know what laparoscopy is? If you tell me no, so I will start at first by telling you what is laparoscopy. If you said this, if you said yes, we know laparoscopy, the next step I will ask you, did you use laparoscopy before, and you know the basic knowledge about using laparoscopy? If you said yes, we know it, I will go to the next step to talk about laparoscopic hysterectomy. So I don't know your basic knowledge. I don't know what is your level of knowledge about this topic. Another example. I want to tell you today about the MRCOG Part 2 course. So I can at first start by asking you, did you join MRCOG Part 2 exam before? Did you study for the exam before? Do you know what is our curriculum? This is snowballing. Why we call this method as snowballing? Because the snowball starts small and gradually enlarges while going forward. So we start by small point. If you know it, I will go to the next step. So this is snowballing. Another example, I want to tell you about uterine artery embolization. I will start at first to ask you, do you know that we have multiple methods to use intervention radiology in our practice? If you said yes, I will go to the next step. If you said no, so I have to explain what intervention radiology. So I don't know your level of knowledge. So I will start by small steps. If you know it, I will go to the next step. This is snowballing. Another method, and we will compare it with also another method. We will compare between simplified procedural hierarchy and complex procedural hierarchy. Simplified and complex. Simplified means that I want to teach you how to do laparoscopic hysterectomy. So I will tell you that you will do so and so, and I will let you later to do it with yourself without giving you a feedback. I just explain the steps how to do, or I will show you how to do, but I will not watch you while doing. I will not give you feedback. This is simplified procedural hierarchy. I will tell you the steps, I will tell you how to do it, but I will not watch you and I will not give you a feedback. While complex procedural hierarchy. In complex, I will tell you how to do laparoscopic hysterectomy, and I will allow you to assist with me during laparoscopic hysterectomy. Then I will start to watch you doing laparoscopic hysterectomy, and I will give you, of course, feedback. And then I will ask you to teach others. You see these steps? It's complex. I will explain, I will let you assess with me, then I will let you do it yourself, then I will let you to teach others. This is complex procedural hierarchy. You know, when you are going to take a course for laparoscopy, for example, you ask, is this course contains hands-on or not? If there is hands-on, so it's complex. So you will learn and you will be observed while doing the method and you can teach others. It's complex. Okay? The difference between simplified and the complex, is it clear? Or somebody wants me to repeat? Simplified and the complex. Okay. Okay, how to do diagnostic laparoscopy. If I watch you while doing and give you feedback and ask you to teach others, it's complex. If just I will teach you how to do without observing you doing, it's simplified. The next method is simulation training. In this simulation training, we use simulators, or we can use actors. You know, when you go to take MRCOG Part 3 course, it's based upon an actor. An actor is acting as if she is a patient and coming in labor. Actor or actress. If there is an actress or a simulator, it's simulation training. Of course, the presence of simulator or actress is a keyword for simulation training. Another method, it has also very easy characteristic words that you are taught by multiple professionals. It's multi-professional training, BROMPT, practical obstetric multi-professional training. So you are taught by multiple teachers, not only one. It's a very easy method. Of course, my course is not prompt. You have only one instructor. Another method, it's called clinical evaluation exercise. And this clinical evaluation exercise, it can be used as teaching method, or even it can be examination method. So it depends upon. I watch you taking history from the patient, doing examination, and telling her what is your management plan. And I watch you communicating with the patient. If I give you feedback and I tell you that you have to improve so and so, it's formative. Just, it's a method of teaching. But if it's as a part of an exam, and it depends upon if you are going to pass or fail, it's now summative, not formative. Formative means feedback. Summative means success or fail, SSFF, success or fail. While formative is, I will give you feedback. So it's not an exam, but summative, it's an exam. When we were undergraduate, learning obstetrics or learning even internal medicine, always the professors saw us dealing with the patients, how to take history, how to do examination, and they gave us feedback. This was formative, mini 6. But at the end of the year, we have an exam. It was summative, mini 6. So it may be formative and it may be summative according to, is it an exam or just training? Another method, which also can be formative or summative according to, is it an exam or not? In this OSATs, it's not a matter of taking history examination. I just want to see you doing a clinical task. It doesn't include taking history. Please, doctor, I want you. I want to see you while doing cesarean section, and I will give you feedback. If I give you feedback, it's formative. If this will make you success or fail, it's now an exam, it's summative. As you see here, there is a professor watching a student while taking a stitch. And I will give you a score and I will give you a feedback about each step. If this is an exam, it's success or fail, it's summative. If this is only a training, it's formative. So, SATs, you are talking about technical skill, technique. I saw you doing something by your hand. While this mini 6, I am talking about how you deal with the patient, how you do examination, how you will give a summary to the patient about her disease and the management plan. So this is only, I will see you while doing something by your hand. But this is a clinical situation. Mini 6, clinical situation. OSATs, I will see surgical procedure and give you feedback. Another method, it's called experiential. Experiential means it's based upon experience. For example, I saw a case of postpartum hemorrhage. And I will tell you that, do you know that I saw yesterday a case of postpartum hemorrhage? The patient was complaining from so and so, and we did so and so, and I told you about my experience in the management of this case. Another example. I will tell you that, do you know that today I saw a case of few chromocytoma. It's my first time to see few chromocytoma. The patient was complaining from so and so. We asked for investigations so and so, and we will give her treatment in the form of so and so. So if you are telling me your experience, after you see a certain case, you are doing now experiential learning. So I am giving you my experience in this point. So I did already this point before. I saw this case before. I will tell you what happened and help you also to do this in your clinical practice later on. So if you see rare case and you are telling it to me, or even if you see a case that you see it for the first time and you are telling me your experience, this is experiential learning. You are telling me your own experience. For example, ST1 is telling the supervisor about a case of postpartum hemorrhage that he saw, and he tells also the supervisor that I did so and so during management, my friends did so and so during management. This is experiential learning. I am telling you my experience. Another method, it's called norm referenced assessment. I am doing assessment against a reference. This reference may be a score. For example, I ask you to do a certain task and I give you a score. And to tell you that you succeeded in this task, I want you to get 90%. So we have certain score, we have reference. This reference can be a score needed to pass, or even can be a criteria needed to pass. For example, you are going to have MRCOG Part 2 exam. After the exam, they say that after doing the curve, everybody who had in the first paper 60%, we consider this candidate as successful. It's reference-based assessment. If you get this score, if you get these criteria, you are successful. Another method, my reference here is your previous performance. For example, I want to give you a score while watching you doing cesarean section. And I compare your performance with your own previous performance. So my reference here is your old performance. And I will see if you are improving or if you are even deteriorating. So I have a reference characteristic word. Ipsative means that I depend upon your previous performance. I compare your current performance with your old performance to see if you are doing it in the right way. Consultant is performed online learning exercise, and the needed exercise to pass is 15 out of 25. So it's reference based. That's why it's norm referenced assessment. Okay, we have in this program an option of what's called raising hand. Raising hand. You will find a button in this Zoom program. It's called raising hand. Please, if you have a mic and you want to solve questions now with me, please press the button raising hand. Thanks, Dr. Tahira. Thanks. I think this is Deputy. Somebody else? Thanks, Dr. Who else?
Hello?
Yes?
Is it appraisal?
You see the question?
I will read the question.
I am hiding the question now. Somebody else wants to participate?
Appraisal? See appraisal?
You can see the question?
Yeah. See appraisal.
Please just raise your hand. Dr. Madu, please read the question.
Yeah, I read the
Watch
question.
out for your camera. You opened your camera. Please, while solving the question, at first,
I have to read the question.
I want you to prepare an answer in your mind, and then start searching for this answer. So don't read the options. Prepare the answer at first in your mind. Okay, please start, Dr. Madu.
I'll read the question. Okay. Every year, a hospital accepts 12 new trainees as a part of the training program. What is the best method to evaluate the new trainee before they engage into the hospital? I think it's appraising.
In this point, the true answer for this question is induction or introduction interview. Your answer is going to be right if D was not present, because introduction interview is apart from appraisal.
Actually, I used to do that PSP calls will be there. Now there they have some people have given answers like appraisal. Some have written induction interview. So what? And actually, some people are telling it's portfolio. So we should go for what?
You know, you are searching for single best answer. We have here two answers which are right: appraisal and introduction interview. Here in this question, he is asking specifically about this step.
Yeah.
You know, if D was not present, we would choose appraisal. But as long as induction or introduction interview is present, I will choose it. Because it's a specific step that he is asking about. Okay, thanks. Somebody else is raising hand? Somebody don't know how to raise hand?
Doctor, can I read?
Dr. Nafisa? Please read the first question.
The facilitator reminds a group of learners about the physiology, pathology, anatomy, ovarian tumor management.
The options.
Schema refinement. Schema refinement. Schema activation. Schema activation.
Reminds means that.
Schema activation. B.
You are right. Schema activation. Why activation, not refinement? Because he reminds. So they already know this basic science, isn't it?
It is.
So if he said that, he is explaining the physiology, anatomy, so it's schema activation, schema refinement. But as long as the question said he reminds them, so they know this information already before. So it's a schema activation. Thanks, Dr. Nafisa. Okay, Dr. Tahira. Question 2.
Is Dr. Sama a method of 5 steps including commitment and justification? It's 1 step perception.
1 minute perception, you are right. 1 minute. It's 1 minute, not one step. 1 minute perception. Okay, and to remind you, I ask the student to tell me about the management and diagnosis plan of certain disease, and I will start listening to what he say, and then I will give feedback and correction of the mistakes. Okay, thank you. Okay, Dr. Debji. Question 3.
Yes, sir. Group of students sit together to discuss a certain topic. It is fishbowl.
Did he tell you that
Or,
you're sitting in a rounded or in a circle and there is an audience? Did he say this?
it's brainstorming.
Why brainstorming? Justify, please. There is no teacher.
No teacher, yeah, it's brainstorming.
There is no teacher. And everybody will say what he knows about this topic. So it's brainstorming because there is no professor. Okay?
Yes.
Okay, thanks, Debji. In fishbowl, he should say that they are sitting in a circle. To say that it's fish.
Circle. Okay.
Okay, so to summarize again, thanks, Debji. The first method, giving lectures. We have professor and audience. Brainstorming, there is no professor. And everybody of us will say what he knows about this topic. Delphi, it can be used by mass media, internet, telephone number, letters. Fishbowl, they should be sitting in a certain manner. Problem-based, I am talking about a case that we saw in our hospital, and everybody assess what he did right and what he did wrong. Okay, the next one, 1 minute perception, which includes 5 steps. A directly observed procedure with feedback. I see you doing something and I will give you feedback. Schema activation. Activation, so already you know the basic science and I remind you again of this basic science. Schema refinement. You don't know the basic science, physiology and anatomy, so I will start at first to tell you about physiology and anatomy related to our topics. Snowballing, I don't know your level of knowledge. So I will start to ask simple questions to see what is your level of knowledge. The difference between simplified and complex hierarchy is whether to see whether if you will give feedback and you will see the student doing this method and you will give feedback and then you will allow this student to do this procedure and also to teach this procedure to others, this is complex. If only you are going to learn and you will not see the student doing the procedure and you don't allow him to teach others, it's just simplified. So this is the difference between simplified and complex. Simulation, it depends upon the presence of a simulator or an actress. Multi-professional, it's multi-professional training, it's very easy. Many clinical evaluation exercise, it's clinical test or clinical training to see how to take history, how to discuss with the patient, how to communicate with the patient, and how to do clinical examination. If you are talking about surgical skill, it's OSATs, technical skill or surgical skill. It can be also formative in the form of training or summative as a part of an exam. Experiential, I am telling you my experience about a case that I saw. Okay, we will take a break only 2 minutes. I will let the same say how to calculate the dose of local anesthesia, because it came multiple times in the exam asking about how to calculate the dose. And there are multiple difficult formulas for calculating the local anesthesia. Here I will give you the simplest method to calculate the dose of local anesthesia. You know that we have two types of local anesthesia, either with vasopressor like adrenaline or without vasopressor. Anyway, it's the same equation. We will multiply 3 or 7. How to choose 3 or 7 according to, if you are going to use local anesthesia without vasopressor, you will use 3. If you are going to use local anesthesia with vasopressor, you will use number 7. So 3 or 7 over 10 multiplied by body weight over concentration. For example, if you have a patient whose body weight is 100 kilogram and you have lidocaine without vasopressor, concentration 1%. So it's without vasopressor, without adrenaline. So I will use number 3 over 10 multiplied by body weight 100 kilogram over concentration 1. This one. So the maximum dose is 30 milliliter. So I will use number 3 or number 7 according to without vasopressor or with vasopressor. Over body weight over 10 multiplied by body weight over concentration. If you are going to use concentration 2%, so here I will put 2. If you are going to use 0.5%, so I will put 0.5. So we can say that this is the easiest method to calculate the dose of local anesthesia, 3 or 7 over 10 multiplied by body weight over concentration. Okay, we have common complication of local anesthesia, including delayed hemorrhage and systemic toxicity. If you are going to use lidocaine or local anesthesia with adrenaline, it has advantage that during the surgery you have less bleeding. But after the effect of adrenaline is gone, secondary bleeding and delayed hemorrhage may occur. Another side effect for this local anesthesia, that systemic absorption may occur. And this systemic absorption can occur by 2 methods. The first method, that the local anesthesia is injected intravascular without intention. And of course, in this method, the peak of concentration will occur immediately because you already injected the local anesthesia inside the blood vessel. Another method, when you inject inside the tissue without injecting into a blood vessel, some of this local anesthesia will be absorbed to systemic circulation. and it will take 10 to 25 minutes to have a peak in the blood. But of course, the peak here is less than the peak of non-intended intravascular injection. If intravascular injection occurs, this will give rapid, immediate peak of local anesthesia. So, lidocaine, we use either 3 or 7. Here you are, Dr. Madu. Dr. Madu, you can ask. Okay.
Hello?
Yes.
Am I audible?
Yes, you are. You are. Here you are.
Yeah. Actually, my question is, yesterday I was reading the start OG and it was written without adrenaline it's 4 gram per kg. And here it's actually some are telling 3 and some are 4. So which one to follow?
Somewhat.
Actually, that dose. So lignogram, how much is the dose? So without adrenaline, it's 3, and in start OG it's written 4. So which one to consider?
4. You say 4?
In start OG it was written 4 without adrenaline, and here means all other books are telling 3. So which one to accept? Because in RCOG exam.
Look, this table is from a TOG article. So this will be our evidence. Okay, I know that also there are other sources which say that lidocaine without vasopressor use 5. Okay, what's mentioned in the TOG article about local anesthesia, this table is a screenshot from the TOG article. 3 for plain without vasopressor and 7 for local anesthesia with vasopressor. That's why
my question is
this one.
Actually it was given in start OG. If any other source, then I would have not asked, but start OG it was written 4, like without adrenaline. So that is also RCOG source. So which one to accept? EOG.
If there is difference between the strategy and the guideline, use the guideline.
And but this is the difference between TOG article and start OG.
Okay, you open the reference for this question.
Oh, no, start OG I was reading, so that is so there only now.
They mentioned the reference, isn't it?
What?
The reference of the answer.
I think questions were there, no? Like this SBA of this start OG there. That question was there. Yeah, I remember. Otherwise, I will send you later.
Okay. If there is an evidence mentioned in this question, please send it to me. Okay.
Because actually, because now I have to search, so it will be waste of time for you also.
Excellent. But as I told you, this is a screenshot from the TOG article about local anesthesia. 3.
So which year TOG is there? I'll read. I didn't know.
I will send the TOG article to you.
Okay, thank you so much. No, I have access. Just wondering. I have access to TOG. Just wanted the year.
I will send the TOG article itself to you on WhatsApp.
Okay, thank you, sir.
Okay, thank you. Okay, thank you. So the dose is 3 without vasopressor and 7 with vasopressor. We have other types of local anesthesia, for example, bupivacaine. But bupivacaine is used for spinal anesthesia. So we are not the one who will calculate the dose of spinal anesthesia dose. Also prelocaine, but the most common one and the most asked one is lidocaine. its duration of action from 1 to 3 hours. Somebody is raising hand. Okay, Dr. Tahira?
Yes, Dr. OSAMA.
Please.
I 80 kg woman pushing for last 1 hour. The CTG is pathological. You decide to do forceps delivery in the room. For pudendal block, how many ml of 2% lignocaine without adrenaline you can safely use? This is lignocaine without adrenaline, so I will use 3. And the weight of the person is 80, and I'm using 2% concentration.
So tell me what to write.
Divided by 10 over 80 divided by 2. So it's 12 ml. It is 12 ml.
So it's 12.
I can calculate here in front of everybody.
You are right.
It is without adrenaline, so I will take 3.
Thank you.
Yeah, it's 12.
Thank you. All right. So
Divided by 10.
over 10 multiplied by
Multiply by weight is 80.
Okay, thank you. Okay, somebody is raising hand. Dipti? Dipti?
Sir,
Here you are, Dipti.
yes, sir. Lignocaine time to pick in the blood if not accidentally injected intravascular.
So we inject it inside the tissue. Some of it will pass to circulation. What time the peak takes to occur?
It should be 10 to 25 minutes.
Thank you, all right. And if accidentally injected intravascular, the peak will take?
3 minutes?
Immediately.
Immediately.
You are injecting it intravascular.
Okay.
Okay. Okay, thank you. Dr. Tahira, do you know what is the antidote of lidocaine if injected intravascular?
Yes, Dr. OSAMA, it's intralipid 20%.
Intralipid, yes. And which one of these? Intralipid? Hello?
I think it's D.
D? What you said?
D, it's 10%.
10?
100 ml it will be 10%.
No, it's 20%. This is the antidote. We will use 20% intralipid. This is the concentration. Intralipid, 20%. This is the antidote of lidocaine if injected intravascular and manifestations of toxicity appeared. We will inject intralipid 20%.